You're listening to the Hoofcare Companion, the podcast dedicated to the science, art and practicalities of keeping horses sound from the ground up. I'm your host, Marc Jerram, and each episode will take a deep dive into the world of hoof anatomy, pathology, care and rehabilitation. Whether you're a farrier, veterinarian, therapist or simply passionate about horse health, this is your space to learn, question and grow. We'll explore the latest research, time-tested methods and real-world case studies to help you better understand the structures beneath the hoof capsule and how to support them when things go wrong. Because good hoof care isn't just about trimming and shoeing, it's about understanding the whole horse. So let's get stuck into today's topic. Hoof wall cracks in the horse, classification, assessment, management and prognosis.
Introduction.
Hoof wall cracks represent one of the most common yet complex pathologies encountered in equine farriery practice. They range from superficial cosmetic defects to severe painful lesions capable of compromising soundness and athletic longevity. For the farrier, hoof wall cracks demand a sound understanding of hoof anatomy, biomechanics, horn quality, and the interaction between trimming, shoeing, and the forces acting upon the foot. Successful management is rarely achieved through a single intervention. Rather, it requires accurate classification, careful assessment of both static and dynamic factors, collaboration with veterinary surgeons where appropriate, and a long-term approach aimed at restoring hoof integrity and balance.
Anatomy and biomechanics of the hoof wall.
The hoof wall is a specialised keratinized structure designed to bear weight, absorb concussion, and protect internal tissues. It consists of tubular and intertubular horn arranged in a highly organised pattern with horn tubules orientated proxima distally. These tubules provide tensile strength while the intertubular horn binds the structure together. The hoof wall is anchored to the distal phalanx by the sensitive and insensitive lamellae forming the suspensory apparatus of the distal phalanx. During locomotion, the hoof wall is subjected to significant cyclical loading. At impact, the wall deforms, particularly at the quarters and heels, allowing energy dissipation. Any disruption to horn quality, wall thickness, balance, or loading patterns can predispose the hoof to structural failure in the form of cracks. Understanding this biomechanical context is essential when assessing why a crack has formed and how it may be managed.
Classification of hoof wall cracks.
Hoof wall cracks can be classified in several ways, most commonly according to their orientation, depth, location, and involvement of sensitive structures. These classifications are not mutually exclusive and often overlap in clinical cases. Vertical cracks run parallel to the horn tubules and are the most frequently encountered type. Horizontal cracks run perpendicular to the tubules and are less common but often associated with systemic or traumatic events. Cracks may also be described as complete or incomplete, sensitive or non-sensitive, and by their anatomical location such as toe cracks or quarter cracks. Accurate classification assists in determining severity, prognosis and appropriate intervention.
Vertical hoof wall cracks.
Vertical cracks originate at either the coronary band or the solar margin and extend along the length of the wall. Their orientation reflects separation along the horn tubules, often due to excessive stress or poor horn integrity. Vertical cracks may remain superficial and non-progressive, or they may deepen and destabilise the hoof capsule if underlying causes are not addressed. Vertical cracks are commonly associated with imbalances in mediolateral or dorsopalmar, hoof conformation, excessive toe length, underrun heels or chronic flare. Environmental factors such as alternating wet and dry conditions can exacerbate horn weakness, increasing susceptibility to cracking. In many cases, vertical cracks are multifactorial in origin, reflecting both mechanical and biological influences.
Horizontal hoof wall cracks.
Horizontal cracks occur across the hoof wall, interrupting multiple horn tubules. They are frequently associated with a disruption to horn production at the coronary band, often linked to systemic illness, nutritional stress, severe laminitis, trauma or coronary band injury. These cracks may appear as grooves or full thickness defects and often migrate distally as the hoof grows. Unlike vertical cracks, horizontal cracks are not typically load-bearing in nature, but they can predispose the wall to further breakdown, particularly if they weaken the structural integrity of the capsule. The presence of multiple horizontal defects may indicate repeated episodes of stress or illness, highlighting the importance of a thorough history when assessing affected horses.
Complete and incomplete cracks.
Incomplete cracks involve only a portion of the height of the hoof wall thickness and do not extend the full length of the hoof wall. These cracks are generally non-painful and may be detected incidentally during routine farriery. While often considered cosmetic, incomplete cracks can propagate if mechanical stresses persist. Complete cracks extend through the full length of the hoof wall, potentially involving the sensitive structures found within the coronary band. These cracks compromise the hoof's ability to bear weight and are more likely to be associated with pain, instability and secondary infection. Complete cracks require prompt and carefully planned intervention to prevent further deterioration.
Sensitive and non-sensitive cracks.
Non-sensitive cracks do not involve the sensitive laminae and are typically non-painful. The horse may remain sound and digital pulses are usually normal. However, non-sensitive cracks should not be dismissed, as they can deepen over time if underlying causes are not addressed. Sensitive cracks involve penetration or compression of the sensitive laminae, resulting in pain, inflammation, and sometimes infection. Horses with sensitive cracks may show varying degrees of lameness, increased digital pulses, localized heat, or reluctance to load the affected limb. Sensitive cracks often necessitate veterinary involvement, particularly if infection or instability of the distal phalanx is suspected.
Toe cracks.
Toe cracks are vertical cracks located at the dorsal aspect of the hoof wall. They commonly originate at the coronary band and extend distally, although some may begin at the distal border of the hoof wall and migrate proximally. Toe cracks are frequently associated with excessive toe length, delayed breakover, and increased tensile forces on the dorsal wall. Biomechanically, the toe region experiences significant stress during breakover. If the hoof is allowed to become long in the toe, leverage forces increase, predisposing the wall to failure. Toe cracks may also be associated with previous laminitic episodes, as compromised lamellar attachments reduce the wall's ability to withstand load.
Quarter cracks.
Quarter cracks occur in the medial or lateral quarter of the hoof and are among the most clinically significant forms of hoof wall cracking. They are often associated with instability of the hoof capsule, uneven loading, or poor heel support. The quarters are designed to expand and contract during a weight bearing, and any restriction or asymmetry in this movement can concentrate stress. Quarter cracks frequently become sensitive due to the proximity of weight-bearing structures and the dynamic nature of the region. They may be unilateral or bilateral and are often linked to conformational issues such as base narrow or base wide limb alignment, as well as shoeing practices that restrict hoof expansion.
Causes of hoof wall cracks.
The causes of hoof wall cracks are multifactorial and can be broadly divided into mechanical, environmental, nutritional and pathological factors. Mechanical causes include poor hoof balance, long toes, underrun heels, mediolateral imbalance and inappropriate shoeing. Environmental factors such as excessive moisture, prolonged dryness or frequent changes between the two can weaken horn quality. Nutritional deficiencies, particularly of biotin, zinc, copper and essential amino acids, can impair horn production and strength. Pathological causes include laminitis, white line disease, trauma to the coronary band and chronic infection. In many cases, cracks develop as the result of several interacting factors rather than a single identifiable cause.
Clinical signs and symptoms.
The clinical presentation of hoof wall cracks varies depending on their type and severity. Superficial, non-sensitive cracks may present with minimal clinical signs beyond visible wall defects. In contrast, sensitive or unstable cracks may be associated with lameness, shortened stride length, uneven gait, and reluctance to turn or work on certain surfaces. Local signs may include increased digital pulses, heat in the hoof capsule, and tenderness on hoof tester examination. In chronic cases, secondary infection may result in discharge, malodor, or granulation, tissue formation. Observing the horse both at rest and in motion is essential to fully appreciate the functional impact of the crack.
Visual assessment. Static examination.
Static assessment begins with careful observation of the horse standing square on a level surface. The farrier should assess limb conformation, hoof symmetry, wall alignment, and coronary band integrity. The location, length, width, and orientation of the crack should be noted, along with any associated flares, distortions, or dishing of the wall. The coronary band should be examined for signs of injury, scarring, or uneven horn production, particularly in cases of vertical cracks originating proximally. Solar examination provides additional information regarding hoof balance, white line integrity, and potential areas of overload that may contribute to crack formation.
Visual assessment. Dynamic examination.
Dynamic assessment involves observing the horse in motion, both in straight lines and on circles, on firm and compliant surfaces. Particular attention should be paid to landing patterns, breakover timing, and mediolateral loading. Horses with hoof wall cracks may exhibit toe first or uneven landings, reflecting discomfort or mechanical imbalance. Slow motion observation, where possible, can assist in identifying subtle gait abnormalities. The relationship between the crack location and phases of the stride cycle often provides valuable insight into the forces contributing to the defect. Dynamic assessment is essential in guiding trimming and shoeing decisions aimed at redistributing load.
Veterinary diagnostics.
Veterinary involvement is particularly important in cases involving sensitive cracks, lameness, or suspected internal pathology. Diagnostic analgesia may be used to localize pain, while radiography can assess the position of the distal phalanx, wall thickness, and the presence of gas lines or infection tracking along the laminae. Radiography also plays an important role in establishing a trimming and shoeing plan should there be any hoof imbalances present. Advanced imaging such as ultrasonography or computed tomography may be employed in complex cases to evaluate soft tissue involvement or subtle bony changes. Collaboration between farrier and veterinarian ensures that treatment strategies address both mechanical and pathological components of the condition.
Trimming principles in crack management.
Corrective trimming is central to the management of hoof wall cracks. The primary objectives are to restore hoof balance, reduce abnormal stresses on the affected area, and promote the growth of strong, well-aligned horn from the coronary band. Excessive toe length should be addressed to reduce leverage forces, and mediolateral balance should be optimized to ensure even load distribution. Flare associated with cracks should be carefully reduced without weakening the wall further. Over-aggressive removal of horn is contraindicated, particularly in cases of complete or sensitive cracks. Regular conservative trimming at appropriate intervals is preferable to infrequent extensive intervention.
Shoeing options and farriery interventions.
Shoeing strategies aim to stabilise the hoof capsule, offload the cracked region, and support physiological movement. Options may include the use of full support shoes, bar shoes, or shoes with modified branches to redistribute load away from the affected area. In some cases, shoeing without nails in the immediate vicinity of the crack is advisable to prevent further wall separation. Adjunctive techniques such as lacing, patching, or the use of composite materials may be employed to stabilise the crack and prevent propagation. These methods should be used judiciously and in conjunction with appropriate trimming and shoeing rather than as standalone solutions. The choice of intervention should be tailored to the individual horse, discipline and severity of the crack.
Long-term management and prognosis.
The long-term prognosis for horses with hoof wall cracks depends on the type, severity and underlying causes of the condition. Superficial, non-sensitive cracks often have an excellent prognosis with appropriate farriery and management. More severe cracks, particularly chronic quarter cracks or those associated with laminitis, may require prolonged treatment and carry a more guarded prognosis. Successful long-term management relies on consistent farriery, attention to nutrition and environment, and ongoing monitoring of hoof, balance and horn quality. Education of the owner or trainer is also crucial, as management practices such as turnout conditions and shoeing intervals significantly influence outcomes.
Conclusion.
Hoof wall cracks represent a multifaceted challenge within equine farriery, requiring a thorough understanding of hoof anatomy, biomechanics and pathology. Accurate classification, careful assessment and evidence-based intervention are essential to achieving successful outcomes. By addressing both the mechanical and biological factors contributing to crack formation, farriers play a central role in restoring hoof integrity and maintaining equine soundness. Through collaborative practice and a long-term perspective, even complex cases can be effectively managed, preserving the health and performance of the horse. Thank you for listening to the Hoofcare Companion. Please follow, rate and share this podcast on your social media to help the Hoofcare Companion grow and reach all of those who care for our equine friends all around the world. Visit the links in the show notes to obtain your copy of my books or to interact on my social media channels. Until next time, thank you for listening, because a healthy hoof is a happy horse.